The signs and symptoms of parasitic infections are also very specific, right? If we look at those wellness type of parasite cleanses, they're very vague. They're things like fatigue, body ache, brain fog, I don't know, sleepiness. There's bloating. You can kind of throw in this big jumble of vague types of symptoms, and then it's like, oh, it's a parasite. That's actually not at all how parasitic infections present. And the reason for that is each one of these organisms, they have very specific life cycles. They reproduce in certain parts of the body. They feed in certain parts of the body. And the signs and symptoms are associated with that. The most common ones are GI symptoms, mainly diarrhea. In fact, diarrhea that lasts for more than 7 days warrants consideration of possibly a parasitic cause. Giardia that we talked about, it causes this really watery, absolutely terrible smelling diarrhea with a lot of abdominal bloating, nausea, and it typically starts about 1 to 2 weeks after an exposure. Cryptosporidium also causes terrible diarrhea. It's usually self-limiting in healthy people, but again, if someone's immunocompromised, it can kill them. Pinworms, which is the actual most common helminth infection, doesn't cause any of those symptoms that I rattled off earlier, the vague ones. It very specifically causes an itchy butthole, and it does so more at night whenever you go to sleep. So if someone has a really terribly itchy butthole every night when they go to sleep, they might want to consider being evaluated for pinworms. Not vague. All that being said, there are symptoms that can happen in other parts of the body. Welcome to No Filter Doctor, where we cut through the health hype, dig into what's real, what's backed by evidence, and what works. I'm your host, Dr. AK. Let's get into it. Hey everyone, thanks for joining me this week. We are actually going to get into part 1 of a 2-part series about parasite cleanses. Now, I didn't think this was something that would require this much focus and attention and time, but it has come to my attention that I was making assumptions that were very much untrue. And this is because a few of my friends in the last few weeks have asked me about them. I had one person who was told by another individual that the reason she is diabetic is because she has parasites in her liver that are eating her insulin, and that if she buys a certain supplement online, I think it's on sale for $220, she can take that and she'll never be diabetic again. Well, my friend happens to be a type 1 diabetic whose pancreas doesn't even make insulin. Another friend called me from a med spa and told me that there is a sale this week at that spa on a parasite detox. It was a cleanse that you take. It was a bunch of different supplements, and that it will clear your body of all of the different parasites that are in there. And I think it was something like $350. I told both of my friends that this is in fact not a thing. But it made me realize that there's a gap here because parasites are a thing. They do exist. There are infections that are out there. There's risks in getting them. There's areas in the world where they are endemic, and there are treatments for them. But a lot of this wellness parasite stuff is completely different. So what I want to do is this week, I want to get into giving you information about what actual parasitic infections involve. What is the vocabulary? What are the different treatments? What are the risks? How do you avoid it? Because I think if you know that going into next week, you'll be prepared, because next week we're going to talk about the actual detoxes and some of the data on that. What's the evidence on some of the substances that are used? Where does it all come from? So this week, we're going to talk about the infection stuff. Next week, we're going to talk about the actual cleanses. So let's get into this. The first thing we need to talk about is definitions. In medicine, the definition of a parasite is very clear. It is an organism that either lives on something or inside something to its own benefit and then causes disease and harm in that host. It's not some kind of symbiotic relationship where both organisms are gaining something from it. It's very much one-sided. And there are all kinds of different parasites that are out there. They have different life cycles, different transmission patterns, different disease states. There are 3 main types of parasites that exist. One is a protozoan. That is a single-celled, microscopic organism that often will infect the GI tract, but it could also infect the bloodstream. It can get into your genitourinary tract and even your brain. A perfect example is something called Giardia. This is a protozoa that actually lives in the GI tract of beavers, and when the beavers poo in the water, the Giardia is released into the stream. So if you happen to drink some stream water that is downstream from a beaver dam, you are at risk for acquiring Giardia, and that'll present with some pretty terrible diarrhea. Another example that a lot of you are probably familiar with is malaria. That is a protozoa. It lives in the mosquitoes. There are gametocytes in mosquitoes. You get bit, the mosquito puts them in your body, and then your blood cells get infected with malaria. So both Giardia and malaria are protozoans, and they are parasites. The next group are helminths. And I think this is what a lot of people think of when they think of parasites, and they're worms. Whether it's a tapeworm, a roundworm, or a fluke, which is a type of worm, those are all in the helminth category. The last ones are ectoparasites. These are organisms that you can see with the naked eye oftentimes, and they live on the outside of the body. Things like mites and lice. They are all ectoparasites. I know it's gross, but we got to talk about it because you need to know so that when you're faced with this stuff out there on the internet or at a different med spa or some dude who tells you you have diabetes because of liverworms, you need to be able to answer back with the facts. So we're going through the grossness. Parasitic infections are actually not that common in the United States. Now, they are common worldwide. The most common parasitic exposure in the U.S. is something called Toxoplasma gondii. And you may have heard of this before, that pregnant women can't change the litter box of cats. That's because cats can carry Toxoplasma gondii. A lot of times you can be exposed to it, but still not get an infection. There was a study published in 2020 where they look at serology of Toxoplasma gondii exposures. So basically what that means is they draw your blood, and then they analyze your blood to see are there any antibodies or evidence of exposures or anything like that. And they found that approximately 11% of the people living in the United States have been exposed to Toxoplasma gondii. Now, that's down from 1994 when it was 22%. But here's the thing, serology demonstrates exposure, not necessarily infection. So even the most common one in the U.S., we're not getting that many infections. It's just an exposure. The most common infection that actually occurs is Giardia, which I mentioned before about drinking stream water. There are about 1.2 million cases of Giardia in the U.S. per year, which sounds like a lot until I tell you the U.S. population is about 342 million people. That's 0.35%. So really not that common. And it is the most common one. I put together a really nice table on the blog, and I'm going to review that with you. So if you are watching the video of this, I'm going to look away because I'm looking at the chart to go through all of it. But I want you to kind of know what is the incidence and what is the risk factors of these different things. So we already talked about Giardia, and the risk factors for that are childcare setting, backpackers, travelers, and men who have sex with men. Cryptosporidium is another protozoal parasitic infection. It's about 750,000 infections per year, and the risks are recreational water exposure, livestock contact, childcare, but most importantly, immunocompromise. And if you have an intact and functioning immune system, your risks are low. But if you have a compromised immune system, you are going to have a higher risk of getting cryptosporidium. Toxoplasma, we talked about, that's the Toxoplasmosis gondii in the cat litter boxes. Other risk factors are immunocompromise, cat feces, and undercooked meat exposure. Next is Chagas disease. Now, Chagas disease is caused by a protozoa called Trypanosoma cruzi that lives in the spit of certain flies. And if you get bit by them, that infection can get transmitted to your blood. Now, this is most prevalent in Mexico and Central America. It's not that common in the U.S., but it is starting. So the biggest risk for that is in the southern states in the U.S. Next on the list is Toxocara, which is dog and cat roundworm. It has about a 5% seroprevalence. So we talked about the seroprevalence with the toxoplasma, about 11%. This one's around 5. So it means we've been exposed, but that doesn't necessarily mean there is an infection. The risk factors are children, people who live in low socioeconomic status, and again, the southern states. That's where this is a little bit more prevalent. Neurocysticercosis. Now, this comes from undercooked pork, typically. If you are into hunting wild game like boars, bears, they all are known to have these tapeworms in their meat. So when you don't heat it to a temperature that's high enough to kill them and then you eat it, you're at risk for neurocysticercosis, which is when these tapeworms can go and infect tissues in the brain. Thankfully, that's only about 2,000 cases a year. And then last on the list, but not least, is pinworms. This is the most common helminth infection in the U.S. In fact, I had the honor of treating a whole family in the emergency department not too long ago for pinworms. The people at highest risk for this are kids because they'll get pinworms, they scratch their bum, they go touch something, now there's pinworm eggs on that. Some other kid goes and grabs whatever it is. Kids who don't wash their hands, they put their hands in their mouth, and there you have it. So, those are really the parasitic infections in the US that we have that are common. The one thing that you have to keep in mind when I went through all those different risk factors, there was no perfectly healthy adult with an intact immune system who hasn't traveled anywhere. That's not a risk. So a lot of these wellness treatments for these cleanses, they're going after people who are typically affluent, who haven't had any exposures, who are healthy, who have an intact immune system. And those are the exact people who have the lowest incidence of actually having a parasite. Actual risk factors are travel to endemic areas with poor sanitation, exposure to poorly treated water, eating undercooked foods, close contact with infected persons, usually a fecal oral type of route of transmission. I brought up kids a lot. So group settings, daycares, occupations that are associated with those daycares, immunocompromised people, and then living in endemic areas, which is in regions such as Latin America, Sub-Saharan Africa, Southeast Asia. So unless you fall into one of these categories, your risk is so low for having any kind of parasitic infection. The signs and symptoms of parasitic infections are also very specific, right? If we look at those wellness type of parasite cleanses, they're very vague. They're things like fatigue, body ache, brain fog, I don't know, sleepiness. There's bloating. You can kind of throw in this big jumble of vague types of symptoms, and then it's like, oh, it's a parasite. That's actually not at all how parasitic infections present. And the reason for that is each one of these organisms, they have very specific life cycles. They reproduce in certain parts of the body. They feed in certain parts of the body. And the signs and symptoms are associated with that. The most common ones are GI symptoms, mainly diarrhea. In fact, diarrhea that lasts for more than 7 days warrants consideration of possibly a parasitic cause. Giardia that we talked about, it causes this really watery, absolutely terrible smelling diarrhea with a lot of abdominal bloating, nausea, and it typically starts about 1 to 2 weeks after an exposure. Cryptosporidium also causes terrible diarrhea. It's usually self-limiting in healthy people, but again, if someone's immunocompromised, it can kill them. Pinworms, which is the actual most common helminth infection, doesn't cause any of those symptoms that I rattled off earlier, the vague ones. It very specifically causes an itchy butthole, and it does so more at night whenever you go to sleep. So if someone has a really terribly itchy butthole every night when they go to sleep, they might want to consider being evaluated for pinworms. Not vague. There are symptoms that can happen in other parts of the body. Pulmonary symptoms can occur when the helminth larvae travel through the lungs. People can have cough, they can have shortness of breath, they can cough up blood even. Certain worms can gain exposure through skin, so sometimes you can get a rash and it's really itchy. And you'll even get these kind of linear type of looking lines. That can happen with different hookworms when they gain entry through your feet. And there are parasites that can infect the liver and the gallbladder. Ascaris infections specifically can go to the liver, the pancreas, the gallbladder. Tapeworms can get into the liver and cause cysts. There's also something called Entamoeba histolytica. It can actually cause liver abscesses. With neurocysticercosis being a brain infection, that's going to cause things like headache, maybe confusion, change in mental status, seizures. And with certain parasitic infections, you can feel fatigue, but the fatigue is secondary to the anemia that they cause. So tapeworms are notorious for that. But it's not vague. It's not like, oh, I have fatigue, and then you go get blood work and your blood work is normal. You have fatigue because you're anemic, and your blood work shows that you're anemic. There aren't things like sugar cravings and some of these other things that you hear out there. This is specific. Real parasitic infections present with real specific symptoms. There's no vague, nebulous complaints here. The other thing about parasitic infections when they exist is that there are very specific tests that you can get to diagnose them. There's nothing that is trademarked that only one company owns to test for parasites. These are CLIA certified tests that you can get at a medical laboratory to get the diagnosis. It could be antigen testing. It could be stool studies to look for eggs. It could be blood smears. It could be looking at things under a microscope, PCR testing. But I do want to talk about one thing that is important to know about really any test. You have to first consider what is the likelihood of someone actually having disease. And the reason why is no test is 100% perfect. Every test that exists, even the approved ones that are in laboratories, have a known margin of error. But you don't know exactly who that error is going to be on. You just know out of every 100 people, X% is going to have some kind of lab error, whether it is saying that something is a false positive or a false negative. Don't know. We just know there's going to be an error. It has to do with something called the sensitivity and specificity of that test. When you have someone who is perfectly healthy, doesn't have any of these infections at all, has an exceedingly low chance of having any of these infections, it is possible for them to take one of these tests and get a false positive. So the test will come back and it'll be like, oh, you have it, when really you absolutely do not have it. So again, when we are talking about testing for things in any kind of medical setting, you really have to approach it first with how likely are you to even have this issue? Did you have any of those risk factors? Do you have any of these very specific symptoms? What have the exposures been? Those are all questions that are really important to ask before we just jump on the whole, oh, well, the tests exist, so I may as well get it. No, because you could get a false positive and then undergo treatment that is completely unnecessary. These are not screening tests, and it's really important to keep that in mind when we're talking about it. Now, let's say you did have an exposure, right? You had risk factors, you have signs and symptoms, you get tested, and you're positive. The way that these are treated are very specific. It is with medications. They've been FDA approved. They've been tested. They are not these supplement stacks and wellness cleanses. Ivermectin, I've talked about it before. Great drug for parasites. There's albendazole, felbendazole, praziquantel, metronidazole. These are all drug names, and these medications are used to treat real parasites. They're not in a cleanse. It all boils down to the fact that parasitic infections are real. And depending on your health status and what else is going on with you, some of them can actually be quite dangerous. So I get it. I understand the whole wanting to be healthy and making sure that we don't have parasites. But the fact is, if you are a healthy adult who has not had any exposures and you haven't traveled to any of these endemic areas, the chances of you having any of these is almost zero. Actual parasitic infections are very recognizable. There's nothing vague about them, and the treatments are very specific. The wellness industry has taken the word parasite and has completely disconnected it from everything that I just talked about. All the stuff that we just talked about, the wellness industry does not apply any of that to their version of parasitic infections. And that is what I want to get into a little bit more next week. I want to talk about some of the terminology that's used. I want to go through some of these different cleanses that are out there. What are the active ingredients in them? Are they effective? Do they cause harm, right? We've talked about that before. You want to do something because it makes you feel good and there's no harm? By all means, who cares if it doesn't work? It's not going to hurt you. But some of these things can actually hurt people. And those are the things that I want to talk about next week. So I hope you're not too grossed out by the things that we talked about today. I know it's gross. I know not everyone can stomach these things, but I do think it's important that you know this first and then come back next week and we will talk about all of the other things that you need to know in terms of the actual cleanses. I'll talk to you soon. Bye. Thank you so much for joining me on this week's No Filter Doctor. If you enjoyed the content, you can follow me on social media. I'm on Instagram, Facebook, and YouTube. You can also go to www.thewholehumanhealthandwellbeing.com and sign up for the weekly newsletter where you will get a link to the blog, that week's podcast, and a health tip of the week sent directly to you. It's important to know that while I am a doctor, I'm not your doctor. This podcast is for educational and informational purposes only, and it's not intended as medical advice. Listening to this podcast does not establish a doctor-patient relationship. The information discussed should not be used to diagnose, treat, or prevent any medical condition, nor should it replace individualized medical care. If you have questions or concerns about your health, please contact your own healthcare provider. Any decisions to delay or forego a medical evaluation or treatment based on the information discussed in this podcast are made so at your own risk. My only financial disclosure is my medical practice, The Whole Human Health and Wellbeing. Take care, and I'll talk to you next week.